Hello and welcome to my channel. I am Henry, a professional psychologist. I hope you will be fine. Today we will talk about what is dopamine, characteristics, function, effects, and medications. We daily upload psychological episodes on this channel. If you are interested, you can subscribe to our channel. We request you to please use headphones for a better experience. Thank you. Now try to understand what is dopamine. Dopamine is a type of neurotransmitter in the brain that plays a role in many functions in the body, including motivation, mood, attention, and memory. A neurotransmitter is a chemical messenger that transmits signals in the body. It also acts as a hormone. Dopamine has a direct impact on the central nervous system, which is made up of the brain and spinal cord. It also plays an essential role in the brain's reward system, where it reinforces feelings of pleasure that people experience when they engage in rewarding activities. These are the characteristics of dopamine. While dopamine is often referred to as the pleasure chemical, this is a misnomer, as dopamine doesn't actually produce pleasure. It does, however, reinforce feelings of pleasure by connecting sensations of pleasure to certain behaviors. It's a feel-good chemical, says Tanya J. Peterson, NCC, DAIS, a mental health educator. It's part of our reward center, and when our brain produces dopamine in response to what we do, we feel good and want to do more of whatever it is that's making us feel so mentally healthy. That, in turn, leads to even more dopamine production. Dopamine is also present in fight-or-flight responses. When experiencing a perceived threat, real or imagined, the sympathetic nervous system, SNS, is activated, triggering the release of dopamine and other catecholamines, which help in responding to stress. Dopamine is produced at a number of different sites in the brain, says James Giordano, MD, MPhil, professor of neurology and biochemistry at Georgetown University Medical Center, including the substantia nigra, ventral tegmental area, the pituitary gland, and in pathways of the hypothalamus. And these are the role of dopamine in the body. Dopamine has a direct impact on many neurological, cognitive, and behavioral functions within the body, says Dr. Giordano, including arousal, movement, regulation of certain hormones and glands, reinforcement and reward, thoughts and emotions. Dopamine affects everything from the way we think and move to the way we remember and behave. However, everyone experiences dopamine differently. How you might feel with low dopamine levels. With dopamine deficiency, you could experience any number of symptoms, such as anxiety, constipation, difficulty sleeping, hallucinations, loss of balance, low energy, low sex drive, mood swings, muscle cramps, tremors, weight change. A lack of dopamine might feel like being forgetful, anxious, inattentive, withdrawn, and emotionally dumb. You might also have stomach issues and coordination problems. How you might feel with high dopamine levels. High dopamine levels can lead to some positive feelings, like having lots of energy, but it can also have negative effects. If your dopamine levels are too high, you might feel aggressive, energized, euphoric, impulsive, interested in sex, unable to sleep. Dopamine's role in mental health. When you have a dopamine disorder, you may experience a decline in neurocognitive functions, which relates to your memory, attention, and problem-solving abilities. Like the neurotransmitter serotonin, which helps regulate mood, dopamine is involved in many psychological illnesses. Abnormally functioning dopamine receptors play a role in some health and mental health disorders. Parkinson's disease. Decreased levels of dopamine can occur in certain neurodegenerative diseases, such as Parkinson's disease, wherein the nerve cells responsible for producing and releasing dopamine are dying, Dr. Giordano explains. Attention deficit hyperactivity disorder, ADHD. Studies have shown that dopamine disruptions exist in those with ADHD, correlating to the symptoms of inattention and impulsivity. Individuals with ADHD may experience reward and motivation deficits, making them unable to modify their behavior to adapt to changing reward conditions. Schizophrenia. Schizophrenia is associated with changes in brain dopamine receptors, as well as dopamine signaling pathways. Antipsychotic drugs act as dopamine antagonists, helping some patients with schizophrenia. Substance use disorder and addiction. Dopamine-triggered conditioned responses that result from certain behaviors, such as drinking alcohol, smoking, or gambling, can lead to addiction. Why some people struggle with addiction more than others could be due to pre-existing differences in dopamine circuits. Major depressive disorder, MDD. MDD is one of the most common mental health disorders, and dopamine deficiency can lead to anhedonia, the inability to feel pleasure, which is often a symptom of MDD. Decreased dopamine function can occur following stress and in certain types of depressive disorders, says Dr. Giordano. Decreased effectiveness in dopamine metabolism and signaling can produce signs and symptoms such as loss of energy, diminished appetite, cravings for fatty and/or sweet foods, decreased desire for and enjoyment of various activities, changes in libido. In such cases, Dr. Giordano explains, people may be treated with antidepressant drugs, which can prolong the effect of available dopamine at its receptor sites, and in this way, amplify dopamine-mediated effects to reduce such signs and symptoms. Medications that affect dopamine levels. Certain medications can be used to help balance dopamine levels in the brain. The type of medication that is prescribed might elevate or inhibit dopamine action depending on the nature of the condition it is treating. Dopamine agonists. Dopamine agonists are medications that mimic dopamine and activate dopamine receptors. Such medications may treat Parkinson's disease, depression, ADHD, low sex drive, hyperprolactinemia, and restless leg syndrome. Examples of dopamine agonists include Dostonex, cabergoline, Miraprex, pramipexole, Requip, ropinirole. Dopamine antagonists. Dopamine antagonists are drugs that bind to dopamine receptors to block the action of dopamine in the brain. Such medications may be used to treat schizophrenia and bipolar disorder. They can also treat nausea and vomiting. Examples of dopamine antagonists include Abilify, aripiprazole, Geodon, ziprasidone, Reglan, metoclopramide, Risperdal, risperidone, Zyprexa, olanzapine. Dopamine reuptake inhibitors. Dopamine reuptake inhibitors are drugs that block dopamine from being reabsorbed by nerve cells. Because of this, it can increase dopamine levels in the brain. Such medications may treat depression, binge eating disorder, and narcolepsy. These drugs may also be used to help people overcome addictions. Examples of dopamine reuptake inhibitors: Cogentin, benztropine, Provigil, modafinil, Wellbutrin, bupropion. We hope you enjoyed this episode. Please like this and share it with your friends. Please subscribe to our channel. Thanks for watching. Goodbye.